A patient visits a healthcare provider for diagnosis, treatment, or consultation. The provider documents the visit in the medical record, including symptoms, diagnoses, procedures, and prescriptions. The doctor diagnoses angina. Doctor orders an ECG and blood test. The doctor review the blood test and ECG, all is normal. Explain the patient condition. And give some prescription of medicine. Patient was discharged stable condition. The insurance company gives the patient documents and converts them to a numerical and alphabet number using the medical coding guideline. Then check the code once all codes because any code is missing or wrongly typed in the charts. It's the go-to denial chart, so the auditing team reviews the chart again. These codes are used to generate claims submitted to insurance companies for reimbursement.